Good afternoon. Excuse me. Good afternoon, and thank all of you for joining us today. We have a few guests with us. We have Baton Rouge Mayor President Sharon Weston Broome with us today. We also have Louisiana Department of Health Region 2 Medical Director Dr. Dawn Marcel and Dr. Jimmy Guidry from LDH. As we have discussed a few times over the last couple of weeks, after many weeks of moving in the right direction in terms of cases, hospitalizations, and so forth, we are now seeing a sustained increase in cases. And today is obviously July the 1st, and I will tell you that over the second half of June, we lost all of the progress that we made in the month of June in terms of hospitalizations. And in terms of the number of cases, in several regions, they're actually back to the highest point that they've ever been. As a result, Louisiana is back squarely on the radar of the White House Coronavirus Task Force. Yesterday, I had a long conversation with Dr. Birx, going over the recent trends that we've seen here in Louisiana. And by the way, they match very much what's going on in other parts of the country as well. But her big concern is the increase in positivity that we're seeing across the state of Louisiana. And you all know the challenge with that. We've increased testing. We're going to talk more about that later. And so you would expect to have more cases with the increased testing. But if the positivity, if the percentage of tests that you're giving resulting in a positive case, if that's going up, then what that means is you actually have more COVID-19 than you did before. And that certainly is the case here in Louisiana. And it was that increasing positivity in our state, and principally here in the Baton Rouge area, which is why Dr. Birx called me yesterday. So in short, the situation isn't as rosy as we would like it to be, and there's a big concern about the number of cases, that positivity we talked about, and the increased number of individuals in our hospitals with COVID-19. As I just mentioned, East Baton Rouge Parish, after great progress over the last several weeks, is also becoming a hot spot again. It was specifically the positivity in this region that caused Dr. Birx to give me a call. And we discussed a plan that we will pursue together, the White House Coronavirus Task Force, the Health and Human Services, and also the Office of the Public Health Service at the federal level, working with GOSEP and the National Guard. We're on a course that by Tuesday we hope to have a number of testing sites open here in Baton Rouge to test an additional 5,000 people per day, just in the Baton Rouge area, to try to help us get on top of this particular situation. And to further highlight just the degree of concern that they have around the country, it's my understanding this is one of 3 such efforts being undertaken anywhere in the country. Again, this effort we believe will start on Tuesday. A lot of work to do between now and then. I don't believe we can set it up and on Tuesday actually have 5,000 individuals tested, but we will get to that number in short order. I also know that Mayor Broome, earlier today I believe, has announced a mask mandate for East Baton Rouge Parish. I want you to know that I appreciate that decision on her part. I support it. I also support similar mask mandates that have been put in place in Orleans Parish and in Jefferson Parish from Mayor Latoya Cantrell and Parish President Cynthia Lee Shang. I would also tell you that in a communication, I think it was dated June the 29th, I saw it yesterday, the White House specifically called out East Baton Rouge Parish as a place where a mask mandate, because of the positivity principally going up, is where a mask mandate should be seriously considered. And the Vice President on the call with us on Monday, a video telephone conference, indicated the White House's support for these measures being taken locally. So I just wanted to offer my support for those mandates as well. I am not today announcing additional restrictions for Louisiana. You will recall that when I announced that we would pause in phase 2 because of the fact that we did not meet the gating criteria to proceed to phase 3, that we would do a deep dive on the data in 2 weeks. We're not quite there yet. I can tell you we're looking at the data every single day, and certainly it's not improving. I just went through that. But we are going to do everything that we can to get more compliance with the restrictions we currently have in place as we are in phase 2, but also get more compliance with the mitigation measures by the general public, things that everybody can do. Remember, everybody has a role to play, and there are things that everybody can do. Principally, they involve wearing a mask when you're outside of your home and you are not interacting solely with members of your immediate household. They involve washing your hands frequently, staying home when you're sick, and maintaining physical distancing when you are out and about. We are going to increase enforcement because we don't want to go back to reducing occupancy if we can avoid it. We don't want to close more businesses and so forth if we can avoid it. But we also don't want a few bad actors, people who are just not honoring the restrictions that are in place in order that we don't want them to prevent us from continuing to move forward. So we're going to be more robust in our enforcement. We are encouraging every business, every venue to do everything that they can to comply with the restrictions that are in place. And I'm also I'm urging the general public, don't patronize businesses that are not conducting themselves in a safe manner and in accordance with the restrictions that are in place. If you must, remember, you're safer at home than you are anywhere else, but if you're going to go out and patronize businesses, patronize those that are interested in your safety. And when you do so, do it in a way that shows you're interested in the safety of your neighbor, which is why you should wear a mask. We continue to see significant increases in cases and hospitalizations across the state. Today, we are reporting 2,083 new cases. You heard me right, 2,083. Now, that's on 23,577 tests. 23,000 tests being reported today. Now, it is true that about 900 of the cases being reported today were backlogged from one commercial lab out of state, but they're not really that old. The oldest positive test result dates back to June the 16th. And so there were about 900 of those, and they're dated somewhere between June the 16th and June the 29th. And so those are very much relevant for the current conversation. But even if for some reason you want to exclude those 900, that's an awful lot of new COVID cases that we're reporting today. We haven't reported more than 2,000 cases in a day since April. Obviously, we should all be concerned. Sadly, we are reporting 17 new deaths for a total of 3,130 thus far. We have 799 patients in the hospital today with COVID-19. That is the highest it's been since May the 27th, when it was 798. That's why I'm telling you, we've given up all the gains that we've made in June, and our trajectory suggests that we're going to give more ground up, and which is why we have to do a better job with the restrictions and the mitigation measures. On a regional level, hospitalizations per capita are increasing in Orleans, Greater Baton Rouge, Acadiana, Southwest, Central Louisiana, Shreveport, Bossier, and the Monroe areas. That's 7 of our 9 regions. In terms of case growth, only 3 of the 9 regions show a slight downward trajectory, and that's really over 3 days. And so 3 days doesn't really make for a trend, but that's in southwest Louisiana, central Louisiana, and up in the northeast Louisiana area around Monroe. Our statewide positive rate continues to inch higher. As of June 26, we're looking at a 9.7% positivity rate for new tests. But there are several regions that are above 10, and you may remember that 10 is the standard that's been set forth by the World Health Organization and the CDC is that barometer where you know that you're where you need to be. On testing, there is a bit of good news in light of the overall effort. You may remember that we announced some time back that the testing goal we had per month that we had worked out with our federal partners in terms of the resourcing and so forth, that we would test 200,000 individuals per month. This month, or I should say in June, we actually tested 385,000 people. That is almost twice our goal, and anyway, it's a good thing because cases are there. Testing doesn't produce a case, it just lets you know where you have them. And if you don't know where you have them, then it's impossible to devise the strategies and put forth the effort necessary to communicate with those individuals, to get them into isolation, and to minimize the spread from those positive cases that you have. And again, yeah, we are testing more, but the case growth is outpacing our testing as evidenced by that increased positivity. We know that the vast majority of our recent case growth is coming from the spread of the virus in communities. And in fact, I will tell you 98% of today's cases come from the community. Only 2% come from congregate settings. With respect to young people, as we have previously noted, there's been a huge increase in case growth among 18 to 29-year-olds. And within that demographic, the cases are especially arising among 18 to 25-year-olds. And you can look at the graph there and see just how pronounced that rise is. And here we are in Baton Rouge, where we have Southern University and LSU and BRCC and so forth. And like college towns all over the country, we are really seeing, not just across the state, which is true, but particularly here in Baton Rouge, a really steep increase in cases with young people in that 18 to 25-year-old range. We do know that age plays a role. We know that your personal COVID risk increases with age, but people, including young people with chronic conditions, whether that's diabetes, obesity, heart disease, lung disease, kidney disease, whatever, they're all at higher risk for serious outcomes from COVID-19. The latest CDC analysis shows that people with these conditions are 6 times more likely to be hospitalized and 12 times more likely to die from the virus. We also know that many people, including young people, don't yet know they have an underlying chronic health condition that makes them more vulnerable to this particular disease, not to mention the fact that we've also seen generally healthy people really struggle with the virus. But regardless, young people with COVID, young people with COVID are contagious, and we need them to be more mindful of their own health, but also we need them to be good neighbors and be mindful of the risks that they pose to others through spreading, especially those who are vulnerable. With respect to nursing homes, a brief update. On June the 17th, as you all know, LDH sent a letter to all nursing homes in the state stating they needed to complete baseline testing of all of their residents and staff by June 30th. I'm pleased to report baseline testing is complete. All the nursing homes participated. We did have a few residents who refused to be tested, and I think perhaps maybe a few staff as well, but the baseline test was complete. Now, I'm going to yield the podium to Mayor Broom She's going to speak, and then she'll be followed by Dr. Marcel. And then Dr. Guidry's going to come up, and he's going to engage in some of the myths that are out there around COVID-19, and he'll explain some basic facts. After that, I'll come back up, wrap up, and take your questions. But Mayor, thank you so much for being with us today, and I want to welcome you to the podium. Thank you.
Thank you, Governor Edwards, and good afternoon, everyone. As you've heard from me earlier, and now Governor Edwards and countless leaders across our state, the coronavirus pandemic presents a clear and present threat to all Louisianians. Our health, safety, economic prosperity, and quality of life are all in danger. And at this point, it is evident that this issue is not going away. As you heard, over the last 11 days, we have seen almost 1,000 new cases of COVID-19 in East Baton Rouge Parish, which represents 17% of total cases in our parish since mid-March. And today, we reported the largest single-day increase of new cases in the last month and a half. The third largest increase since this pandemic came to our community in mid-March. And so my community and other communities around the state must recognize the severity of this situation. Baton Rouge is experiencing a resurgence of the coronavirus pandemic. Regions around the state are experiencing rising case numbers as well. And so as we move forward to this new reality, it is critical for each and every one of us to continue intensively adhering to mitigation guidelines. I know that Governor Edwards, Dr. Bu, and countless other leaders in our state have reiterated this statement more times than any of us really can count. And so my message to all Louisianians is simple. It's a message I said for my community of East Baton Rouge Parish. Save a life, save our economy, and wear a face covering. And so in the last few weeks, I've heard from representatives in all sectors of our community, residents, businesses, healthcare providers, and community leaders. In fact, Governor, someone sent me an email and they said, well, Mayor, you made it a requirement for all city parish employees to wear masks and anyone coming into a city parish building to wear masks. Aren't you concerned about us as well? And the truth of the matter is, I am. I'm concerned about every resident of the city and parish of Baton Rouge and East Baton Rouge Parish. And so as I announced earlier today, I will be signing an executive order to mandate face coverings, particularly when residents are inside businesses. This executive order is not a punitive measure. We are not sending out law enforcement to find violators. This is an effort to protect the health and well-being of residents and visitors and to assist in the safe reopening of the city-parish economy without the need for the stricter economic mitigation efforts put in place earlier this year. The policy is rooted in the common sense measures of our medical community and the data that we have received and their agreement upon our decision. We all know this, and we've heard it time and time again. We understand that masks don't stop the spread of the virus, but they do reduce the risk of spreading it to those around us. And so business owners, community leaders should implement a no mask, no service policy in order for Baton Rouge to stay open and not regress to previous phases. We're going to have to do this. And so this face covering policy will help ensure our businesses can remain open, protect their employees, and safely serve our customers. As Governor Edwards mentioned, in the coming weeks, residents around Louisiana will have access to coronavirus testing sites as a result of a coordinated effort between local, state, and federal officials. I'm very glad to say, and I want to thank the governor and his team for working with us, that in East Baton Rouge Parish, we will have 4 testing sites that will be testing 5,000 people a day. They will be located, as I understand it at this point, at Cortana Mall, Southern University, Greater Baton Rouge State Fairgrounds, and Louisiana State University. In closing, let me just say this. I've made this appeal to the citizens of East Baton Rouge Parish, but I recognize that here in Louisiana, we are an interconnected community. Moving Louisiana forward is a statewide effort as well. I often say this is short-term discomfort for long-term gain. Small sacrifices will allow us to progress forward without the threat of reverting to where we once were. We don't want to go backwards. And I look forward to the day when I can report to my community that everybody in East Baton Rouge Parish has access to a vaccine. We can do this. We can save lives. We can save our businesses and our economy. But we have to do it together. So work with me to save lives, to save our economy. Effective action requires urgency, and we can't wait. Thank you once again, Governor, for the opportunity.
Good afternoon. My name is Dr. Marcel, and I am the Regional Medical Director for the Capital Area Region for LDH, Office of Public Health. And the reason I've been invited to speak here today is because in East Baton Rouge, we are, as previously stated by our governor, experiencing a noticeable and significant sharp increase in the number of new cases. It's very concerning, and so we are here to inform and reiterate the messages that you have received all along of why it is so important to wear masks, thank you, Mayor, to physically distance, and you can remain social while being physically distant, and to wash your hands. In addition, hand sanitizers are also found to be effective. Just be sure there's a 60% content of ethanol, and that it's not past the expiration date. With that, I'd like to start on a positive note with a story of recovery. And I recently learned of this story from an acquaintance whose 45-year-old previously healthy spouse was admitted in a hospital in a neighboring parish. He was diagnosed with coronavirus, and his physical condition, his medical condition, continued to deteriorate. And so he was transferred here to one of our major hospitals in Region 2 in East Baton Rouge Parish. The course was long. The course was intense. That's why it's the intensive care unit. And it was scary. It was very scary. He was intubated for a period of time, and there were many days when they weren't sure what the outcome would be, all compounded by the fact that family couldn't be close at hand. In addition, there were numerous family members who tested positive, including an aunt who had a previous existing history of kidney disease requiring dialysis. And so there was a lot of concern going on in this one family unit. I am glad to report that his wife shared with me that he is recovered. He is at home, stable on room air, and doing well. And so I share this because every coronavirus diagnosis will not lead to serious illness or death in all, but it really can, and we don't know who that person will be. We are starting to know what certain risk factors are, including underlying comorbid conditions such as hypertension or type 2 diabetes or other cardiovascular disease, but we don't know. And while the average age of death in Louisiana recorded is 74, what we do know is that it is not exclusively a disease for those 65 and older. Early data, especially from other countries, was significant for our people in the age group 57 years of age and older. But what we are finding is that there is still unnecessary morbidity and premature death that could be prevented in young adults and even children. So we just want to take this opportunity to reiterate and inform all of us of why it is so important to continue to do as we've been advised long before today. Wear masks, physically distance yourselves while remaining social, and wash your hands and use sanitizers. And one other thing I'd like to share is just the tremendous job that the health system, the health and hospitals in East Baton Rouge Parish and throughout our region and across our state did. And one reason that we never made the news for how bad it was and because we always had a bed available for those who needed it is because our hospital systems came together and collaborated in a way that was truly unprecedented, and it worked. And we're ready. It can happen again, but it doesn't have to. And we all have a part to play in this. And could something as small as wearing a mask make that big of a difference? The answer is yes, yes, and yes. Thanks.
Good afternoon. There's a lot of questions around what does it mean if I get exposed? So we have all these myths. Antibody tests prove that you can never get COVID again. No. What people don't understand is when there's a new virus in town and you haven't been exposed to it before, you really don't know how this virus is going to affect you, the community, because it can create antibody change in your body, and that antibody's there for a while and then it's gone. So will you get it again? We really don't know. We've seen some people can get it again once they've had it. So it hadn't been around long enough for us to know. So what do? We look at science of what other viruses do, and we look even as far back as 100 years in 1918 Spanish flu, and what happened with those things when people had a pandemic. People don't quite understand pandemics because they don't happen that often, and they don't have that experience, so they don't know how serious they can get. So we really don't know the answer to this question. So the fact is, oh, well, I got a test and it was positive and I'm not going to get it again. Don't know the answer to that. So just because you had a positive test or you have a positive antibody test doesn't mean you won't get it again. Next myth, people should try to get COVID to build immunity. This is a common thought that people think if you get it, then you won't get it again. That's a myth. But then if you won't get it again, you also create where there's what we call herd immunity, which means when people get it, enough people get it, then the virus is held at bay because the bodies that have gotten it, creates this herd immunity where the herd protects everybody else. Well, you got to get to 60%, at least 60% of people having COVID. We're not there. There's not herd immunity right now. So that's a myth to think, well, let's all get it, and then we won't have to worry about it. That's not going to be the case. One thing with viruses, the more infections they cause, the more they can change. And they can change to be a worse virus, or they can go away. And you don't know which way they're going to go. So by just letting everybody get it, you're playing with fire. You're really trying to figure out this virus, and you're saying, come on, let's all get it. Many of you remember, those that are older, when you were younger, the virus chickenpox, people would say, let's get the kids to all get it, and then they'll be immune. We don't know that about this virus, and so you can't take that attitude, well, let's just go ahead and get it and get beyond it. It's not necessary to quarantine while you wait for your test results. So what happens when people are told you've been exposed? Oh my God, I need a test. I need a test now. So I was exposed yesterday. I go in, my test is negative. I haven't even developed symptoms. I haven't even developed, the virus may be in me. I may not be sick, and so I can go back to work. No. If the virus entered your body, it's building up. It's building up steam. It may not show up in you for 14 days. So to try to get back to work built on a test in time does not answer the question. So 1 day later, negative test. 3 days later, You might have a positive test, but you went back to work and you didn't check again. So what's happening is that a lot of people are using testing as a means of trying to get out of the 14-day quarantine, and that doesn't work, because if you've been exposed to an active case, there's time for that virus to build up, and you may have negative tests 3 days, 7 days later. So that's why we tell people, stay home. You've been exposed to a case, stay home for 14 days. Next fact. Yes, I don't need to give information to contact tracers if I've already called my friends and family. So all you care about is your friends and family. What about everybody else who had exposure to you within 6 feet for more than 15 minutes? They were exposed. They need information. There's a myth that people think that when they give information like that, well, I was at this bar and there were 20 people there and I spent 3 hours there, and every one of them I had close contact. Actually, we were sitting at the same table playing cards or whatever, and they're not family. And if I don't give those names, I may not even know their names, but I can give the location I went to. I can say I went there and I spent hours there, and I can say how many people were there, and I can also say none of them were wearing masks. So they can try to help people who have been exposed, who don't even know they've been exposed. And so that is a fact that people need to understand. So they'll notify exposure, and they'll also help people get resources. So while you're staying home quarantined, they can help you get your groceries, they can help you get your pharmaceuticals if you need medications, and you don't have to go out again and infect people. Critical. Next myth. I think that we're at the end of that, but seriously, this disease is coming back, and it's coming back with a vengeance, and we better start getting serious. And I thank the efforts for the governor and the mayor.
So that's our version of Mythbusters here at the state capitol. Thank you, Dr. Guidry and Dr. Marcel and Mayor Broom. I'm going to take your questions here in just a moment. But everybody's mindful that Saturday is the 4th of July and Independence Day, and we know that people want to participate in various celebrations and so forth. Obviously, with the numbers that we're talking about right now, we need people to be extremely careful and mindful of all the restriction and mitigation measures that are in place. And I would point back to Memorial Day. And the reason is, you know, at the peak of our previous hospitalizations, we had over 2,000 people hospitalized at the same time in Louisiana, and then those hospitalizations started decreasing in a steady fashion. The low point for hospitalizations in Louisiana was June the 13th. On June the 14th, they started going back up, and they've been going up ever since. What happened 2 weeks before June the 13th, which is that incubation period that Dr. Guidry was just talking about? Memorial Day. And so what we're seeing right now really started with behavior on Memorial Day, the additional contact that people made with one another, unmindful of the mitigation measures that they needed to be following in too many cases, and that disease started to spread again. And now we're approaching the 4th of July, and we really can't exacerbate the current trend with a repeat of what we saw over Memorial Day. And so I am directing this communication to everybody in the state of Louisiana, reminding you that you have a role to play, and it's an extremely important role. And in fact, if we don't all do what's required of us, it's going to be extremely difficult to get back on top of these numbers and turn these trends around. You know, I'm a veteran, but you don't have to be a veteran to be patriotic and to want to celebrate our nation's birthday. But patriotism is not about putting your own health at risk or putting other people's health at risk. And that is certainly not being a good neighbor. So I'm asking people to plan to do better. Don't go into a large crowd. There is no safe large crowd. Period. I'll be spending my July 4th with my immediate family. I strongly recommend, as does the leadership at LDH, that you do the same. If you just insist on watching some fireworks, do that on television or maybe virtually. I know that a number of the larger fireworks displays that typically happen have been canceled. That's the right decision, but there are going to be some that take place. Some of them will be promoting virtual viewing. Others will be promoting folks staying in their cars in order to make sure that they remain socially distanced and in contact only with people from the same immediate household. So I would ask everyone to be mindful of all of these things. So not just this weekend, but especially this weekend right now. Let's be good neighbors and do what has been asked of us. And I want to say happy 4th of July to everybody, and God bless. And with that, I'll take your questions, and you can address questions to the other individuals who have briefed here today as well. Sam?
Governor, I think a week or two ago you said the prospect of moving back in phases or adding new restrictions was not currently on the table. Is it safe to say that those are on the table now?
No. Look, at some point, if we don't get off of this trajectory that we're on, we're going to have to impose more restrictions, because what we are not going to do, and I want this to be crystal clear to everybody in the state of Louisiana, we are not going to threaten our ability to deliver health care, not just to COVID-19 patients, but to anybody in the state of Louisiana who needs to be treated in a hospital. And they could be stroke victims or heart attack victims or motor vehicle accident victims, you name it. We are not going to get back there. But having said that, we're not at the point yet on those hospitalization numbers, even though the trajectory is obviously concerning, where there's an immediate threat. What we are going to do is we're going to double down on our communications, try to get more assistance from leaders at all levels, not just elected leaders like Mayor Broome, and she's certainly doing her part, but business leaders. Look, if you're in the business community and you want to make sure that the economy does as well as possible during this public health emergency, and that as many businesses are open as possible, and employees back at work, and customers in the stores and in the restaurants, then you need to do your part. Because I will tell you, the surge we've seen in cases is not because we went to phase 2. It's because people aren't engaging in the proper behaviors, the appropriate behaviors. And this is really clear if you look across the country, because you have somewhere close to 40 states right now with rising cases. And their early experience with COVID-19 may not have been as severe as ours. Some of them did a full stay-at-home order like we did. Some didn't, and the timeline was all different. But if you look across the board now, you have cases going up. And the reason is not because the economies have been opened up to the degree that they have, but because there's too much complacency. And there are people who are just simply not doing what they need to do, given the amount of COVID that we have in Louisiana and around the country. So we're going to focus on enforcing the restrictions we have in place in phase 2. We're going to focus on getting better compliance from individuals, and we're going to enlist the assistance of everybody that we can to make that happen, while we continue to increase testing, while we continue to increase our contact tracing and all of the other efforts that we've been making as well. Yes, ma'am.
What does enforcement look like from your perspective? Is it engaging the local police to get them to go in when there are reports of businesses that aren't complying? Is it getting the fire marshal in the enforcement?
Yeah, it's all of that. Because what we don't want to happen is to eventually be faced with the very issue that Sam just asked about, where we really are thinking about going back to phase 1 or phase 0, the stay-at-home order. We don't want to do that. So right now we want to get more compliance. We want to make sure that businesses are doing what they are required to do and operating safely. And that means enforcement, and that means fire marshal's office. It means the Department of Health. It means working with local political subdivisions on this as well. But you know the best enforcers out there? It's the general public. If you refuse to go in a store that isn't operating safely, that store is going to change. That restaurant will change. That business will do whatever is required. Yes, sir.
You mentioned the possibility of suspending liquor licenses for bars that weren't compliant.
I'm not aware of any. I can tell you the compliance checks will continue. They will be more numerous. People that they can't operate. But they will decide that, not me, because if they're going to operate, they need to do so in a safe manner, in a manner that's been prescribed in phase 2. Yes, ma'am.
So we're seeing long lines at community testing sites, and some of them are shutting down earlier in the day because they're running out of tests. I talked to a healthcare provider today who told me they were going to cap the tests they're offering at the community testing sites because they want to make sure they have capacity for their patients. Is this an issue if we're seeing community health sites capping their testing, or?
Yeah, well, we want as many people to get tested as possible. And we told you that the tests administered in the month of June in Louisiana were, what was the number that I gave you? 385,000. So we've greatly ramped up the testing that we've been doing before. I think that, but we're still in the process of ramping up the manufacturing of all of the test kits, the swabs, the viral transport medium, and the test tubes, and all that sort of stuff. And so it obviously is a challenge. Our testing at the rate that we have. And so, yeah, it's a challenge anytime, and a concern anytime that you have people who want to be tested and they can't because there's not enough collection kits available out there. We're going to continue to work in order to resolve that, but nobody should give up. There's still plenty of tests being conducted every single day all over the state of Louisiana, and I will tell you, the mayor was exactly right. We're looking at 4 or 5 principal sites here in East Baton Rouge Parish to get to 5,000 tests per day, but we're also going to augment those sites with mobile testing so that we will be getting out into various communities and make it as easy as possible for individuals to access the testing that we're going to make available, whether or not they have transportation. And so she's exactly right. We expect the biggest numbers will be tested at those fixed facilities, but Mayor, we're going to get out into those communities as well, and that's why the National Guard is working so hard with GOSEP in order to get all the assets and resources in place to do that. Yes, sir.
Governor, earlier you said you support the local mask mandates. I guess I'm curious because you said repeatedly that mask mandates at a state level would be hard to enforce, and the states that have done them have gone back on that. I guess why, if you support the local ones, why not do it at this?
Yeah, and well, it's the same reasons that I've been talking about all along. We have made every effort to be as transparent as we can be at the state level with respect to the data, and we share it with you. We've made every effort to be consistent in our decision making with the guidelines that we are getting from CDC and from the White House Coronavirus Task Force. At the end of the day, I think that's how you have the support of the most people possible for the decisions that you make and the mitigation measures you put in place and the restrictions that you put in place. And at the end of the day, it is not currently recommended by the White House guidelines that you have mandates en masse from the state level, but rather you do it at the local level as the situations dictate and warrant those measures. Now, at the end of the day, my message has been entirely consistent. People should wear a mask. The only people who shouldn't are those who are under 2 years old and those who have a breathing difficulty. Everybody else should wear a mask when they're out of the home and interacting with people who are not part of their immediate household. It really is that simple. Now, it is true that many states that have implemented a statewide mandate reversed course in short order because of issues related to enforcement and so forth. I think those issues are minimized if the mandates are consistent with the White House guidelines and the information that we're getting out of the CDC. So it's an effort to try to make sure that as many people as possible will follow what is the so forth, and that's why we've tried to be as consistent with those guidelines. Yes, sir.
Anecdotally, it seems that most health or food service workers and service industry workers fall in that 18 to 29 age range, and that seems to be where the problem is primarily in bars and restaurants. Have you given any special consideration to that? For example, like mandating testing for service industry workers before they return and open their doors?
Well, I can tell you that there are a number of restaurant owners and bar owners who are mandating that their workers be tested before they will put them to work. We do mandate that all those individuals wear masks, by the way. That is part of a mandate that we have ongoing. And so your point, I think, is well made. And that's one of the reasons why people ought not go into an establishment where waiters and waitresses and so forth don't wear a mask. It just shouldn't happen. And those owners shouldn't allow that to happen either. Yes, ma'am.
I have a question for the mayor, actually.
Well, very good. Mayor?
I promise to take really good notes if we see anything.
Then we're all set.
Phase 1 and Phase 2. As it relates to enforcement, and someone asked the question earlier, you know, when we started phase after the stay-at-home order, or even during that season, indication of businesses, individuals who were not in compliance, our Baton Rouge Police Department made a courtesy call, a polite call to that business, to that area, and as a result of their presence going there, then the situation was mitigated. And so I anticipate that they will be part of the enforcement. I've also collaborated with our state fire marshal, and I have also put our Baton Rouge Fire Department on notice as well. And so, of course, that enforcement would involve a misdemeanor, and any type of fine, of course, would be left up to the judiciary. But as I said earlier, we don't want to enforce or fine our way out of this. We want people to comply. And I believe our message here today is very clear, very distinct. We are trying to save lives, trying to save our city and parish. I anticipate moving forward an elevated participation and compliance with wearing a face covering.
So the start date, though, is
Oh, I'm sorry.
in a few days or in a week?
Oh, no. The start date will be tomorrow. As we go into this 4th of July weekend, I think that's very important. Yes, sir.
Mayor, is the mask mandate for just inside businesses or buildings, or?
That's what we said at the earlier press conference, yes.
At the testing sites that y'all are setting up in Baton Rouge, is anyone going to be able to go get tested? Like, I'm asymptomatic and I just am concerned I can go get tested, or do you have to have symptoms?
It's my understanding that anyone will be able to go get tested, and I will say at many of our sites, we will also be providing masks for individuals as well. But I want to reiterate, and I know the governor and Dr. Guidry, Dr. Marcel also have indicated this. I don't like for people to get hung up on the word mask. I want people to wear face covering. So sometimes people say, well, I don't have a mask that looks like this. Well, you may have a band, a scarf. It's so synonymous to mask. But if this or one of the colorful masks that some of us wear, put a face covering on. It serves the same purpose. Thank you.
Okay, a couple of more questions. Unless you don't have it back here.
Just elaborate a little bit more about the 900 case backlog that you said,
Yeah.
even though it's go back up 2 weeks.
Okay, so we are reporting tests today, 23,577 of them. Of those tests, we're reporting 2,083 cases, meaning those 2,083 of those tests were positive. More than 900 of those tests came from one commercial lab out of state, and those results actually go back as far as the 16th of June. Typically, the overwhelming majority of cases we report on any given day are only a couple of 3 days old. And so anytime we're reporting a large number of cases because a backlog from one or more labs came through on that day, we try to make sure that we alert that to you. Again, it's an effort that we're making to try to be as accurate and as transparent as possible. Now, having said that, those cases all relate to that time period that I talked about that really started after the middle of June, when we've lost all of the gains that we had made over the month of June with respect to hospitalizations. Yes, ma'am.
In some states now, we're seeing concerns about PPE shortages again.
Yeah.
Is that anything you're hearing?
No, it's not anything that I'm hearing now. We obviously continue to monitor that very carefully. We continue to work with FEMA on PPE. PPE is more available through the traditional distribution channels and vendors for our healthcare facilities. And so it's the case where nursing homes and hospitals and other providers are able to access more of the PPE that they need in the way that they always have. Having said that, we continue to receive PPE and distribute it. There are packages that go periodically directly to nursing homes, and FEMA is sending those out, and those have been very, very helpful. And so I'm not going to tell you we are without challenges on PPE. I will only tell you that compared to where we were 2 months ago, we are much, much better off there. Yes, sir.
Will there be an effort on the state's part to target, or at least make a targeted effort to test more young people?
Well, yeah, and absolutely, and you're gonna see that. And I want to remind people that a test is a snapshot. I think Dr. Guidry said this. You can test. You can be exposed to the virus yesterday, test today and be negative, and test tomorrow and be positive. So you shouldn't let your guard down if you receive a negative test. It doesn't. It should, I guess, make you feel better that you don't have COVID as best they can tell at that moment. But there's so much of the virus out there, and your exposure may have occurred so recently that you don't have the viral load to test positive when you test, but the exposure has already happened. And so testing is incredibly important, and we want people to be tested, and that includes a lot of asymptomatic people. Remember, we've been saying for a long time now, according to CDC studies and so forth, somewhere between 25 and 40% of the total population who's going to get COVID will be completely asymptomatic throughout, but yet they are contagious. And it appears that a big percentage of that 25 to 40% are going to be the younger folks. And so we are going to have to start increasing our testing among asymptomatic individuals. That's just something that we have to do, and we will be doing that. That's going to be part of our efforts going forward. But as one of you mentioned, there's still not as much testing available as we would like. And so you still have to have priorities, and it's really hard not to prioritize symptomatic individuals who are more likely to have it and need to know if they have it and so forth. And so we've still got a lot of challenges. We're in a better place than we were before. We know a lot more than we knew before. We're testing a lot better and in a lot greater numbers and all those. But this virus is still very difficult to deal with. And you are the lucky person.
I have a question for Dr. Guidry.
That's perfect. All right, so I won't be coming back to the podium. Dr. Guidry will close us out whenever he finishes his question. I do want to again wish everybody a wonderful 4th of July weekend. Please be responsible, be safe, and make sure that you follow these mitigation measures and be socially distant, physically distant, wear your mask, wash your hands, and don't go anywhere if you are feeling ill. Doctor?
Okay, if you're exposed, and that exposure means you were near someone for longer than 15 minutes and closer than 6 feet. I was exposed to a positive, and you feel fine, but you were told by the contact tracer, you've been exposed, you need to quarantine for 14 days. So there's no reason to run out there and get a test that day because chances are it's going to be negative, and there's really no reason to do it until you start seeing symptoms. You can do it and find out, hey, I have it asymptomatic, but it doesn't change the 14 days. You still need the 14 days to see if this virus is going to multiply and cause symptoms and make you infectious. So a test, if you have it, it lets you know you have it. The ones that need to know they have it are the ones that are very sick or the ones that need to be treated as best you can. The rest of us that have been exposed and have had that kind of exposure, they just need to wait and see if they get symptoms and get a test a little further down, because a negative test, if we start doing a test every day to try to go back to work, that doesn't work. The 14 days protects you. The testing doesn't protect you if you feel fine and you don't think you have it, but you could have it and you could be spreading it. So you're going back to work and exposing everyone. So just take the 14 days to wait and see and run the test later rather than sooner, because there's no need to have a test if you're feeling fine. Thanks.
Hi, baby.